early childhood mental health services. Thank you very much.
Thank you. Thank you, everyone. Okay, well, welcome. And welcome to you all. I know you've been here for a bit, and we're excited to continue our conversation. And we're going to start by asking Governor Murphy to speak a little about why and how you have prioritized youth mental health in your administration.
First of all, it's great to be here. Caitlin, thank you for moderating this discussion. I'm incredibly honored to be with the Senate President, with two, let's go. Reginald Atkins, the otherwise known as the human applause machine out there. As well as with Christine Norbert Beyer, who is an outstanding leader of our children and families, as well as Brian Bridges, who's our Secretary of Higher Education. I want to thank Sergio and your colleagues for hosting us so graciously, to the Mayor, Senator Cryan, to the other representatives, members of the Assembly, commissioners, and elected officials. So, Caitlin, this was an issue that we were dealing with if we were to have this discussion in March of 2020. We would have been having a similar. I also want to thank the big man, Lamont Repollet, and Kane University for hosting us. We would have been having this discussion, plus or minus some of the contours, if this were 3 years and 3 months ago. So it's not like the pandemic invented a mental health challenge among our youth. It's made it a lot worse. It's made it a lot urgent, but it existed in January of 2020. And there are many experts in here who have forgotten, including yourself, who have forgotten more about this than I'll ever know. But the causes of that, in addition to the pandemic, I assume social media is high on the list. I assume, without taking sides, a very divisive political and societal reality where it's an us against them thing. I'm sure that opioids and other substances are also high on the list of contributors. But the fact of the matter is, as we sit here on June 13th, 2023, we are dealing with a big, big youth mental health crisis. Everybody from our littlest up through the college folks that Brian and Lamont and others deal with and oversee. So it's real, it's pervasive, and it's an all of the above moment. So there's no one. I don't want to speak for the Senate President or any of the other elected leaders, but I think I can safely say that all of us believe there's no one magic wand here. I'm incredibly proud that working with the Senate President and Senator Cryan and other leaders here, we've been able to come up with a $5 million investment in Union County mental health services that was just voted on last month. And I want to thank the Senate President and the other leaders. This will be money that will go into services. It'll go into actual infrastructure. It will go into data, just getting our hands around where the gaps are. Like everything else in life that we deal with, there are huge inequities within the mental health challenges. So invariably, Black and brown and underserved communities and kids are going to have what the rest of us have, but even in a more extreme sense. And it's not just the $5 million, it's a $50 million investment we've put into this. I think you had a panel on the Children Family Services of Care discussion earlier. That's another example. I think Christine is going to talk about NJ4S, which is another approach. I'll conclude with what I said a minute ago. There's no one door through which we can walk. I wish there was, that we can walk and with confidence and say we can crack the back of this. But I do think if we come at this from a whole variety of angles, we can bend the curve in the right direction. And I'll leave it there if I may. Thank you.
Absolutely. So I am in complete agreement that it is a multifaceted, multidisciplinary approach that we all are taking. And I think the other factor that we learned in COVID was about connection and the importance of connection and what happens when we don't have connection. And so I'm interested, Senate President Scutari, if you can speak a little about that, or actually a lot of it, about the $5 million that the state has allocated to Union County recently for child and adolescent mental health care, and share a bit about what impact you believe funding will have on access to services in Union County, and anything else you'd like to share about Union County's mental health efforts.
Thank you very much, and I want to thank the governor for being here today and helping to highlight this amount of money that was streamlined through a process known as the JBOC Committee, the Joint Budget Oversight Committee, which sometimes doesn't get all the greatest accolades that it should, but this is a really great example of how we can put money to work really quickly through that expedited process of a joint committee. So government does work, and it does work, I don't want to say occasionally, but it does work. And just a few opening remarks. I went to Kane College when it was Kane College here, and so I've adopted this university obviously as my own, but it is the hometown of Senator Joe Cryan. With his partnership, we wouldn't be here. Thank you, Joe. Thank you very much. I only live 2 towns over, but I got my start here. I got my degree in psychology from Kane College at the time, and then, as much as now, it was not. We've done a good job, I think, at putting mental health issues right up front for people to see. For many, many years, these were types of issues that were just hidden, kept under the carpet. It wasn't felt that it was something that you could treat. It was something that you could ignore your way out of. And I think that people in general, and government particularly, and I want to thank our whole County Commissioner Board for helping take that lead, and Assemblyman Atkins, they do a great job in county government with their interaction here with Kane College, Kane University. Keep calling it King College because when I went here. But, we've got great partnerships. So to the board, congratulations for that. Thank you very much for everything you do in supporting these efforts. And then finally, just in my first silliest remark, I just want to talk to the president. I have my Kane gear on today. You might not think. Made sure. I had to take the tags off today, Lamont. I'm going to wear this all the time when I come on campus, though. So, in a more serious note, I'm really proud of the work that we've done in the legislative process and in all levels of government to bring the mental health crisis to the forefront, because for so many years it was something that was not only ignored, but thought that we could ignore our way out of it. And we know we can't do that, and we shouldn't. We can trace back so many ills of society to mental health issues: homelessness, unemployment, underemployment, mass shootings, gun violence, you name it. Lots and lots of things can trace their roots to folks that just aren't getting treatment or help that they need when they need it. Addiction services. I've become of the opinion that we need to be able to be immediate in our response to addiction services. When someone is ready to take that step for help, there can't be barriers, because any little barrier will send them backwards. So the money that government spends on this, you will get back tenfold. And I think there's studies that show how much that you'll get back with respect to the investment you put into mental health crisis intervention, addiction services. Those are the roots of many of the problems that we're facing in society. And the fact that, they always say, one of the first steps is acknowledging there's a problem. There's a problem. We know that it's out there, and it could be people that are very close to you and you don't recognize it. So recognizing those signs and making sure that the stigma attached to where it was for so many years is no longer there. I think government's done a pretty good job at doing that, particularly here in New Jersey, especially in Union County. And moving forward with continuing efforts to fund programs to make sure that we can get the health providers on the ground, train them up, encourage them to be in this space. It's not an easy space, I can tell you that, because I have a master's degree in psychology. I went to law school after that. So I can tell you that it's a tough profession, and it's got to be one that people are 100% committed to do, because you're dealing with very difficult issues and very difficult problems, but it's stuff we need to do. I tell people all the time, you can't ignore folks. That's why we have public education in New Jersey, one of the greatest ones in the world, because If we don't educate people and we don't provide counseling services that we need, these are the same people you're going to be in line with in the supermarket or in line at the gas station. And you don't want them to have an incident there with you. So we've got to continue to treat everyone with respect and make sure that we have the necessary services. So with the governor's help, this $5 million is a down payment that I championed to make sure that we continue to take the steps in the right direction. I can't think of a better place to do it than here in Union County, cooperation with Kean University, the university of my choice. Thank you.
Thank you. So you were just mentioning something that we say a lot in our work. So our work is primarily focused on infant and early childhood mental health. So starting at those earliest moments of family formation, in pregnancy, and then forward. And what we'll say is that infant and early childhood mental health, or early relational health, as we now are using more, partly because of the stigma of the word mental health. Sometimes we might enter a door, open a door a little bit more broadly by talking about relational health, which is really where mental health is begun, in those earliest relationships. But we'll say that early relational health is everyone's business. And what we mean by that is it literally is everyone's business, not just the mental health professionals, but our attorneys and our government and our community health workers and our nurses and our early intervention workers and our teachers. And so many more of us in our communities really responsible for health and relational health and mental health being everyone's business. And it has an economic argument to it too. As you said, if we do well, our entire society benefits down the line.
And if I
Go ahead.
just follow up, just one thing that I had a thought, not that recently, but I've been thinking about it. We recommend people to have an annual checkup once a year. Now, a lot of people ignore it. If you're like me, you probably ignore it for 3 or 4 years, but you shouldn't. But we never think about mental health as a checkup because people don't think that they need it. Sometimes you don't know it until you need it. And that's something I've been just kind of rooting around, thinking about a way to make that more of a regular kind of a check-in with folks, because people, believe it or not, people use their friends and their relationships for their mental health all the time. I mean, you don't realize it, and probably some of you do, is that your friendships are your counselors. Not everybody has those same type of relationships that they can count on, and that's something that I've been just kind of, I forget the word the governor used when he talked. Let me noodle on that a little. I've been noodling around with that for a while. So.
Yeah, and I think that perspective shifts what we've had before, where the stigma is it's only at these dire moments, but actually what we're talking about is wellness. And the Commissioner and I were just speaking about that as we were walking in. So Commissioner Beyer, I wonder if you can speak a little bit more of what we heard Assistant Commissioner Molly Green start talking about in regards to the children's system of care and its broad scope of services for children with mental health concerns and their families. We know that the Youth Mental Health Continuum of Supports in New Jersey is very broad, including the Pediatric Psychiatric Collaborative, Nurtured Heart, I know we learned about earlier today, suicide prevention efforts, and more than 57 family success centers. Can you speak to those initiatives and also the newest initiative that the governor advanced, the New Jersey Statewide Student Supports Services Network, which thankfully has the acronym of NJ4S, because that's a lot of S's to say.
Yeah, thanks, Caitlin. So for many of you who were here this morning, you got to hear an excellent panel talk about the children's system of care and the integrated network that we have built over the last 20 years here in New Jersey. And if you don't get to travel around the country or hear from counterparts in other states, you may not know that New Jersey's system is really touted as being like the best in the country. It's the most comprehensive. And so internally, you know, it's nice to hear that, but internally in the department all the time, we're like, but it's not good enough, right? Like we still have so much work to do, but really, feel very lucky that we do have the depths of service that currently exists. And thanks to the governor and the legislature, pre-COVID, the governor invested over $100 million into the children's system of care to shore up those services and our provider network. And I sit here today saying that had that not happened and had we not had the foresight to actually invest in that system, the children's system of care probably would not exist today as a result of COVID and the pandemic and, much of what's happening with our workforce and just in general, the fact that we have providers and families struggling now and really needed that boost. So I just really want to thank everyone who was involved in helping to support that. The other thing about the children's system of care, though, is that it's really rooted in deep-end clinical intervention. It is, we do have mobile response and, we're meeting people typically at the point of crisis. That's many times when a parent will pick up the phone and call Perform Care and say, I just don't know what to do. My child needs help. My family needs help. And while that is excellent, the fact that we have that any parent can call anytime from any place in the state, regardless of income and eligibility, to be able to seek services for their child. What we know is that not every child needs deep-end intervention or needs clinical intervention, and yet they still are struggling with their mental wellness or mental well-being. And I think that's what's so important in this conversation today and looking at from birth through college age and beyond, that we're supporting our youth and young people, and that we really need to focus, and in this administration, we really have been over the last 5 years focusing on prevention and early intervention and thinking about how do we create a full continuum of service for children and families in New Jersey. And so one of the ways we're doing that is through NJ4S, which is Statewide Student Support Services. It is a lot of S's, but I think what's so unique about the program also is that it will have the capacity, and we're building that up now, in order to provide service or offer services to every school district in the state. And that's something that has not existed here. There is a lot of really good work happening in our schools. We know that. There's a lot of really committed educators and administrators, counselors every day working for students and for their families, and yet it's not been a coordinated effort. And there is not equity amongst the state. We know that some districts have more services, more supports available to students and their families than in other parts of the state. And we really feel that it's our responsibility to be building out this network to be able to support families and children no matter where you live in the state, no matter what school you attend. And so as a result of that, with NJ4S, which it's a network of hubs, 15 hubs, that actually match to the 15 CSOC vicinages. Very intentionally, we did that so that there's a connection to the children's system of care, and so there is a continuum of service. But also, NJ4S, like what it will offer is not just for young people, it is a prevention program. It is and will be focused on prevention services, anti-bullying programs, and substance abuse prevention, and preventing teen parenting, and suicide prevention, using evidence-based programs that, again, evidence-based meaning that they've been proven to show positive results. And through the hub and spoke model, the schools will be able to request services from the hubs. There will be prevention specialists, there will be clinicians, and through making that request, the hubs will then be able to either connect directly, or I think what's most important is that they'll be able to connect the schools and the child and parents to existing community resources. One of the things that is really unique about this program is that it will give us an opportunity to leverage existing resources in a way that we really haven't done before, that we haven't been able to do, through the development of a database that's currently under construction, almost done. At the point that a school asks for services or supports, that will all be captured, and so we'll know in real time, and at the end of the year or end of a couple years, where our gaps in services are, what are schools asking most for their students, what are parents asking for, because this program is not just for students, and it won't just take place in the schools. it's also an opportunity to connect with parents, to provide parents the resources, the education, the supports that they need. Earlier this morning, during the panel, I heard a woman in the back of the room ask a question about services for her 15-year-old son or a 15-year-old child, and how do we, engage that child in services. But I heard it also from the perspective of parents, and what can parents do? And I know as a parent myself of a 22-year-old and 15-year-old that when I offer support or services, they look at me like, no way, Mom, right? Like, we don't want to hear anything from you. But if they talk to their friends or a school counselor or a coach or somebody that is not always their parent, there's an opportunity to connect them to needed resources or services. But as a parent, even in this field and in the work that I do, I still feel sometimes at a loss for how do I engage my child, or how do I talk to them about really serious issues of suicide and depression and anxiety. Those are really hard conversations for parents to have. That's one of the things that NJ4S will offer, is that it will provide parents also with education, with the ability to attend, sessions or services or education courses in order to be able to help identify maybe needs of their child, but then also their support. So that program will be launching in September. The 15 hubs, we have already selected the providers. We've been meeting with them from the department on a weekly basis. And, they already have their advisory boards. Many of them are set up because each will have a local advisory board, really helping to determine their services and supports that are needed in their area. So it's just an example of, and I think you'll hear more about NJ4S specifically from one of the providers in the afternoon. So I'll stop there, except just to say that prevention program of really helping students that maybe don't need a clinical intervention, but need some connection, need to an understanding of how to build resilience and how to even support another peer, are things that we're really excited about and think will be a game changer here in the state.
Caitlin, if I could add just a couple of quick thoughts. First of all, the murderer's row of elected officials in this county is overwhelming, and I want to single out that Union County has 3 extraordinary senators: Senator Scutari, the Senate President, Senator Cryan. We've also now been joined by Senator John Bramnick, and it's evidence yet again that things like supporting youth mental health knows no political party or bounds, and that's always incredibly refreshing and strengthening. So, Caitlin, 2 quick thoughts. First, I was at a national, Christine, you'll probably never speak to me again. I'm at a national governor's event where I'm the chair, and we're discussing youth mental health, and I very forcefully say, we've got something coming in September. It's called NJ4S. Someone raises their hand and says, could you just remind me, what are the 4 S's? And I said, frankly, I don't know. I just hope one of them isn't sucks. So please forgive me for that. But when we first started to unveil this, there was a rightful group of folks who raised their hand and said, wait a minute, there are plus or minus, Christine, about 2% of the kids in our state who have shown acute, obvious evidence of mental health challenges that already get first-class treatment. And so folks said, hey, wait a minute, this hub and spoke model, you can't throw the baby out with the bathwater, as it were. We've got something that's really working. And I want to emphasize 2 points that Christine has made. Number 1, we're not doing away with that. We're going to actually do and both. And secondly, actually I'll make 3. Equity is an issue that we can't ignore, and that invariably those 2% of the kids that are getting the really top-notch services probably don't match up demographically with the diversity of our extraordinary state. And secondly, I think even more importantly, is we're casting a wide net because we actually don't know how many of those kids out there may have undetected, undiagnosed, some level of anxiety, even if it is at an acute level. So the thought is, let's keep the intensity with which we're known for those folks who are, those precious kids who are exhibiting this, but let's cast big nets around the state and hopefully pull in a whole lot of other kids who we can get them to break to the high side and reach out to them in a way that we couldn't otherwise. Nick, you want to say?
You want to see anxiety, you should try running the Senate Democratic Caucus. I did want to just interrupt just for a second to recognize our hometown mayor, not necessarily this, but very close by. One of the largest mayors around is Chris Bolwich is here, always been a great supporter of the university. Thanks for being here, Mayor. And the governor's already mentioned that Senator Bramnick is here, but that's a testament to the bipartisan nature of these efforts. And I appreciate Senator Bramnick working with Senator Crine and myself in efforts like these because they're so important. They transcend any kind of partisan politics that you see. And not that we have that much in New Jersey, I will say, and I know I'm digressing for a second, that in the Senate we enjoy a very good bipartisan relationship, myself and Senator Bramnick and his leaders on his side of the aisle, especially with dealing with important issues like this.
Yes, thank you. And I was thinking of what you were saying around we need this checkup. And a lot of what is proposed in NJ4S is almost that. It's promotional. It's saying this is for everyone. And it takes into account what I have learned in my career as a community-based family therapist, which is we go where the people are as opposed to asking them to come to us. And we think about context and we think about community and we think about mental health outside of the individual and thinking about it much more in its community and in its context. So I'm so excited to see what comes of this new initiative. And we have more. So Secretary Bridges, can you share a bit about what's happening for our, I guess, oldest children in college, and share your thoughts about including college students in youth-focused mental health efforts?
Sure. Well, thank you for the opportunity to be here and be here at Kean University. I get to work with Dr. Repollet, Dr. Rep, as he's known here. Get him to take you on the tour of Kean on the golf course. That's a well-deserved. I don't know, Governor, have you been on the tour on the golf cart?
I have not.
Well, you know, I'm glad that we're here to talk about youth mental health and have college students considered part of that. We have to think about the spectrum of what youth comprise, as has been alluded to here today. You know, one of the things, for those of you who are parents out there, you know that your kids, once they turn 12, they swear that they're adults. And I have one that just turned 13 yesterday, and she, in her mind, she's an adult. But they're still all dependent on us in many ways, even when they're in college, traditional college-age students. And so the idea of how all of this came about, we did a survey of students in the fall of 21. So remember, think back, fall of 21, October of 21. We did a survey, had 15,000, well over 15,000 students respond from 2-year, 4-year institutions, public, private, for-profit as well. Over 15,000 students, we asked them several questions about COVID recovery. 70% of them said they were more concerned about their mental health in October of 21 than they were in October of 20, during the depths of COVID. So we knew that we had to do something about this. And in working with the governor's office, we were allocated some substantial ARP funds. We consulted with my colleague over at DCF about the continuum of this youth mental health initiative, and we're able to implement 3 elements of a program that will have what we think broad impact across the state. First, our partnership with You Will. They're a telehealth mental health provider that will provide for the next year, due to the ARP funds that allocated by Governor Murphy and the legislature, will allow us to partner with You Will to provide 24/7, 365 access to mental health providers, to counselors. One of the things we heard in that survey, students noted that they were having difficulty getting served by the counseling staff on our campuses. As we know, you talk to any college president, that, and as all of you out here who are in the counseling profession know, the field was decimated by COVID. People just left the field. So our campuses were ill-equipped to provide mental health support and really could only provide it really 8 to 5. And in many instances, students had long wait times to get service. So this will respond to that directly. Another part of our initiative will allow our institutions to partner with community mental health providers, whether it's local, state, or national mental health providers, to partner to provide the unique needs that mental health needs that students might have in whatever the local context is, whether it's at a rural campus in like Ramapo in the northern part of the state, or at Rutgers Newark, or Rutgers Camden, or at a large university, a small university, two-year school. Different students have different needs, and so they will be able to, we're providing grants to institutions to partner with local, state, and national providers. And then last, because we know that so many people have left the profession, what we want to do is provide grants to each of our institutions to do some professional development so that those who are there on the campus, whether they're faculty, staff, what have you, can do at least some triage. We know that they're not full-time professionals with 1,500 contact hours or whatever the necessary number is, but they could provide some triage to help a student in the meantime until they get the support they need through our telehealth partnership, for instance. So what we often like to use the comment that I've heard from the governor's office often, that we're trying to leave higher education in New Jersey better than we found it. And this is part of that effort, because I believe strongly that this is providing us, this service that we're providing now will serve us tomorrow, 10 years from now, 20 years from now, because we will have a healthier and more whole citizenry in the state of New Jersey.
Yeah, that does. Thank you. And I'm applauding the creativity and the reach of these programs. And a term that we were kicking around during COVID was COVID-tunity. You know, what's come from COVID that actually is an opportunity for us. And it sounds like not only just what we're doing with college students, but across the panel, we have a lot of COVID-tunity moments.
And Caitlin, I just want to also give a shout out to the Senate President, because, you know, mental health, as I mentioned, how the field has been decimated, the Senate President was a leader in pushing through an initiative for loan redemption for behavioral health providers, those who, if they serve the state for 6 years, could get tens of thousands, up to $150,000 of their loans removed or forgiven if they provide 6 years of service to the state, and that's administered through our Higher Education Student Assistance Program. And to give you a sense of how much in demand there was, HESA had to shut down the website because there was so many applications for the funding that we had provided. So, Senator President, thank you for that investment to pull more people into this much-needed profession and then to provide them with some relief.
Free money, amazing. Who would have thought people would be calling off the hook? But I thought it was important to continue to encourage people into this field because of the rigors and the difficulties of it. If we can make it a little bit more financially available to them, it's one of the things that I think we can do in government.
And just, I wanted to add on to that also, because you've referenced it a few times, Brian, about the field being decimated. And DCF actually engaged in a workforce analysis and study. We had consultants come in and talk with many of our providers, our higher education institutions and leaders around the state to look at what we will need to build and grow for this workforce at all levels of staffing over the next 10 years. And so that, we actually did a webinar last week. Some of you may have participated. That information and a copy of that webinar is available on our website at DCF. And I would encourage and invite all of you to participate in sessions that we will have coming on for the next few months. You can register now to actually be a part of those conversations and making recommendations for how we will, over the next 10 years, be able to really shore up and solidify our mental health workforce.
Thank you. That's incredibly important to be able to see these good programs through. Absolutely. So Governor Murphy, we're going to finish with you. You are near to wrapping up your year as chair of the National Governors Association, during which you've made youth mental health the focus of your initiatives. Can you talk a bit about that initiative, what you've learned, and maybe what's to come next month?
Thank you, Caitlin. This is an incredibly challenging topic that we're dealing with, but there is some good news. And we have to acknowledge that. I think, Nick, you said this, the very fact that, part of the road to salvation is that you face up and realize that you've got a challenge. I'd also suggest that part of the road to salvation is look at the crowd here and the amount of experts and elected officials and senior public servants and educators. This is a real testament, I have to say, to the fact that we have a big challenge, but we're aware of that. We're in the room, and we're talking about it, and we're putting things to work. The second piece of good news, and this gets to the National Governors Association, and this is true, I think we should all be proud to say this, is that in many respects, Christine has already alluded to this, we are the gold standard. So one of the benefits of the National Governors Association, by the way, is all governors. It's not just Democrats or just Republicans, it's all. And we convene a number of times a year, and we constantly want to rip pages out of successful playbooks that we see, but the amount of pages that we rip versus the pages that get ripped out of our playbook is in huge imbalance. And so while this is incredibly challenging, our kids are our most precious things, we have a lot of work to do. We should also be proud of the fact that we set the standard. I'll give you one that's not directed at youth, and that's this program now called Arrive Together. And again, I want to thank the Senate President, Senators Cryan, Bramnick, and others here for funding this. This is if somebody calls into a law enforcement entity in our state, whether it's local, county, or state police, and they've got a mental health incident. It's been a pilot, I think, beginning on July 1st. When we get this budget over the goal line, it'll be everywhere in the state. That call is answered by a plainclothes member of law enforcement in an unmarked car with a mental health expert. And those two individuals make the decision at the point of attack as to who goes in first. And it literally is batting in its pilot phase at or near 1,000 in terms of diffusing. So that's one example. That does not exist anywhere else in the United States of America, and I hope it does sooner than later. Real quick, when you become the chair of the National Governors Association, you raise money into an initiative that you pick. Your First Lady picks one as well, and to your point a few minutes ago, Caitlin, we deliberately picked two that were sort of hand in glove. I picked strengthening mental health among our youth. Tammy picked infant and maternal health, which she's been on since day one. So, and those go hand in glove. On the strengthening the youth mental health, you then go around the country, you convene experts from both red and blue states that approach things like this differently. So we went from Salt Lake City to Santa Monica, California, to Detroit, Michigan, to Philadelphia, Pennsylvania, and we will end up on July 12th in Atlantic City, New Jersey, with a playbook for dealing with each of these huge challenges. Our playbook will have 4 pillars, and I'll leave you with this, and I think it's consistent with the discussions you've been having today. First one is basically prevention and resilience. What can we do to get out ahead of this so that the crisis doesn't befall another one of our precious kids? The second pillar was awareness and destigmatizing. The words we use, the way we approach this, etc. The third pillar was access and affordability. Again, huge equity elements, huge implications for insurance coverage, treating mental health on a pari passu basis as physical health, which is what we need in society and is not the case today. By the way, Nick, to your great program, enormous shortage of mental health professionals around the country. We are no exception to that. And then the fourth and final pillar, in acknowledgement of the fact we don't have enough professionals, let's train the rest of us educators in particular, family members, other leaders who are not professional mental health qualified professionals, but if we can broaden the net in that respect, we can touch more of the kids. We can somehow get them into some program, some pipeline that they might not otherwise be in today. Thanks.
Thank you.
And I just want to follow up on that. And people probably realize this in the audience, but the Arrive Together program is Union County, again, is at the forefront of the implementation of that program through Prosecutor Daniel and our commissioner boards and Mayor Figueredo from the actual hometown mayor, Manny Figueredo. I just wanted to clarify that. But Union County is at the forefront of that program, and I think it's a wildly successful program already. Going to continue to make sure that this is spread out statewide to help alleviate unnecessary police interactions and provide actual real services that people are in need of when they call the police. And people call the police for lots and lots of things that really police officers have been called to become so many different things. A lot of things they're not necessarily trained for beyond what we think of a police officer. So it's a great program. Happy to partner with the governor's office on that, and I'm really proud that Union County is at the forefront of the implementation of the Arrive Together program with Matt Plack and as the Attorney General. Thank you, Governor.
Yeah, thank you. And, it speaks to mental health as everyone's business, which also means we have to share responsibility. And it does sound to me like many of the programs we've talked about today thus far is recognizing the prevention, promotion, and intervention level and the shared responsibility that we all have to address youth mental health. So I'd like to thank our panel for using your power, your position, your influence, and your leadership as service, and for creating programs that we all hopefully will benefit from. And to thank all of you for your attention today. I believe we are up at lunch, so that's a welcome reason to say thank you. And so you can all go to lunch. Thank you.